Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Polymyalgia Rheumatica and Giant Cell Arteritis. Introduction. Polymyalgia rheumatica, also known as PMR, causes muscle pain and stiffness in your neck, shoulders, and hips. It is most common in women. PMR almost always happens in people over 50. PMR sometimes happens along with Giant Cell Arteritis, or GCA. GCA is a condition that causes inflammation of the arteries in the head. PMR usually gets better when treated. Without treatment, it usually goes away after a year or more. Untreated, GCA may cause blindness or stroke. This program explains PMR. It discusses the symptoms, causes, and treatment of the condition. Polymyalgia rheumatica and Giant Cell Arteritis. PMR and GCA are inflammatory disorders. This means they cause inflammation in certain parts of the body. Redness, heat, pain, and swelling indicate inflammation. Inflammation helps protect diseased or injured tissues. In PMR, the joints and the areas around them get stiff and may ache. It mostly happens in the neck, shoulders, and hip. In GCA, inflammation happens in the blood vessels that carry blood up through the neck to the head. It mostly affects the arteries that carry blood to the eyes, temple, and jaw. This is why GCA is also called temporal arteritis. PMR and GCA can happen at the same time. They affect the same groups of people. Researchers believe that the two problems are linked. Symptoms. Symptoms of PMR often start suddenly. In some cases, PMR happens overnight. In others, it is more gradual. The main symptom of PMR is stiffness after resting. Other symptoms include muscle pain and aches in the neck, upper arms, shoulders, and hip area, a low fever, tiredness and lack of energy, depression, weakness, weight loss. A limited range of motion in the arms may be a sign of PMR. Arteries on the temple or forehead that are swollen, lumpy feeling, or tender may be a sign of GCA. The signs and symptoms of PMR usually happen on both sides of the body. Stiffness in affected areas can happen particularly in the morning. It can also happen after being inactive for a long time, such as after a long car ride. Symptoms of PMR get worse without treatment. See your healthcare provider if you feel aches, pains, or stiffness that are new or unusual, disrupt your sleep, limit your ability to do daily activities such as getting dressed or going up and down stairs. Also tell your healthcare provider if you start to experience blurred vision or double vision, jaw pain or tenderness, loss of vision, scalp tenderness. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Experts do not fully know the cause of PMR and GCA. PMR often develops at certain times of the year. For this reason, researchers think that a virus or other environmental factor may contribute to the disease. This has not been proven, though. PMR may be an autoimmune disease. This means that PMR causes the body's immune system to attack healthy tissue by mistake. Risk factors for PMR include age, sex, ethnicity. PMR usually only affects older adults, especially people over 50. The average age at onset of the disease is 70. Women are about 2 times more likely to develop the disorder. Having certain genes may increase your risk of PMR. People of Northern European origin are more likely to have PMR than are people of other ethnicities. People living in Middle Eastern and Asian countries have the lowest rates of the disease. Complications. Symptoms of PMR can greatly affect a person's ability to perform everyday activities. Complications can affect a person's health, social interactions, physical activity, sleep, and general well-being. The pain and stiffness may contribute to difficulties with certain tasks. These include getting out of bed, standing up from a chair, or getting out of a car, bathing, combing your hair, or performing other tasks related to personal hygiene, getting dressed or putting on a coat. Complications of GCA are more serious than those of PMR. People who have GCA need treatment right away. Complications include blindness, aortic aneurysm, stroke or mini-stroke. Blindness is the most serious complication of GCA. Swelling caused by GCA narrows your blood vessels. This reduces the amount of blood, oxygen, and nutrients that reach your body's tissues. When blood flow to one or both eyes is reduced, sudden vision loss can happen without pain. This is often permanent. An aneurysm is a bulge that forms in a weakened blood vessel, usually in the aorta. The aorta is the large artery that runs down the center of your chest and abdomen. An aortic aneurysm may burst. This can lead to life-threatening internal bleeding. GCA may cause a blood clot to form in an artery. This can stop blood flow to the brain and cause a stroke. Symptoms of a stroke include dizziness, numbness, weakness on one side of the body, problems talking and understanding communication. A mini-stroke causes symptoms that are similar to those of a stroke, but it usually only lasts a few minutes and causes no permanent damage. Mini-strokes are sometimes a warning sign that a more severe stroke may happen later. Diagnosis. To diagnose PMR and GCA, your healthcare provider will do a physical exam. He or she will ask you about your past health and symptoms. Because PMR and GCA often happen together, it is important that your healthcare provider find out which one is causing your symptoms. GCA can be serious and needs immediate treatment. Treating GCA requires higher doses of medicine than PMR. Tests that can help diagnose PMR and GCA include erythrocyte sedimentation rate, or ESR, complete blood count, or CBC, C-reactive protein, or CRP, temporal artery biopsy, ultrasound, magnetic resonance imaging, or MRI. An ESR test measures how quickly red blood cells settle in a test tube in 1 hour. A high ESR may be a sign of PMR or GCA. A CBC is a blood test that can show if a person has anemia. People with either PMR or GCA often have mild anemia. A CRP is a blood test that measures the amount of C-reactive protein in your body. This protein is made when you have inflammation somewhere in your body. Both GCA and PMR can cause a high CRP level. A healthcare provider may perform a biopsy. He or she will remove tissue samples and examine them under a microscope or using other methods. A biopsy of the temporal artery can confirm a diagnosis of GCA. In this biopsy, a surgeon will take a sample of a blood vessel from your temple and test it for inflammation. In some cases, an ultrasound or MRI of the arteries on the side of the face near the temple may help diagnose GCA. Your healthcare provider may use these tests to find inflammation of tissues within the shoulder and hip joints to diagnose PMR. Your healthcare provider may confirm a diagnosis of PMR with a trial of anti-inflammatory corticosteroid medicine. If you have PMR, your symptoms will most likely go away within 2 to 4 days of starting treatment. Treatment. PMR usually gets better with treatment. Without treatment, it may go away after a year or more. Your healthcare provider will give you corticosteroid medicines to treat PMR and GCA. Most of the time, symptoms improve quickly. Relief from pain and stiffness should happen in the first 2 or 3 days. Symptoms often go away completely 2 to 4 weeks after the treatment begins. If you are not feeling better in a few days, it is likely that you do not have PMR. Most people need to continue to take steroid medicines for 1 to 2 years. This helps to control symptoms. It also helps to prevent the problems from coming back. Some people will have a relapse and need additional treatment. Relapse means that the problems return after a period of improvement. After the first 2 to 3 weeks of treatment, your healthcare provider may gradually decrease your dose of steroids. This depends on your symptoms and the results of ESR and CRP protein tests. The goal is to keep you on as low a dose as possible without causing a relapse. Some patients benefit from taking an immune suppressant called methotrexate, Trexol, along with corticosteroids. You will need frequent follow-up visits to your healthcare provider. He or she will monitor how the treatment is working and whether or not you're having any side effects. People who stop taking the medication too quickly are more likely to have a relapse. PMR may cause you to be inactive for a long period of time. Your healthcare provider may recommend physical therapy to help you regain coordination, strength, your ability to perform everyday tasks. Healthy lifestyle choices also can help you manage the side effects that may result from corticosteroid treatment. Eat a healthy diet of fruit, vegetables, whole grains, and low-fat meat and dairy products. Limit the salt in your diet to prevent fluid buildup and high blood pressure. Ask your healthcare provider if you should take calcium and vitamin D supplements. Talk to your healthcare provider about exercise that can help you maintain a healthy weight and strengthen bones and muscles. Assistive devices may make everyday tasks easier. Examples include reaching aids, carts for luggage or groceries, and grab bars for the shower. Wearing low-heeled shoes can reduce your risk of falling. Talk to your healthcare provider about using a cane or other walking aid. These can help you prevent falls or other injuries. Your healthcare provider may also recommend that you get a pneumonia vaccine. Your healthcare provider may know if there are any local support groups in your area. Talking to others who are living with the same illness and challenges can be helpful and encouraging.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Polymyalgia rheumatica, also known as PMR, causes muscle pain and stiffness in your neck, shoulders, and hips. It is most common in women. PMR almost always happens in people over 50. PMR sometimes happens along with Giant Cell Arteritis, or GCA. GCA is a condition that causes swelling of the arteries in the head. Symptoms of PMR can greatly affect a person's ability to perform everyday activities. Complications can affect a person's health, social interactions, physical activity, sleep, and general well-being. The main symptom of PMR is stiffness after resting. Other symptoms include muscle pain and aches in the neck, upper arms, shoulders, and hip area, a low fever, tiredness and lack of energy, depression, weakness, weight loss. PMR usually only affects older adults, especially people over 50. The average age at onset of the disease is 70. Women are about 2 times more likely to develop the disorder. Complications of GCA are more serious than those of PMR. People who have GCA need treatment right away. Complications include blindness, aortic aneurysm, stroke or mini-stroke. PMR usually gets better with treatment. Without treatment, it usually goes away after a year or more. Your healthcare provider will give you corticosteroid medicines to treat PMR and GCA. Thank you for using Explain.